So I'm just going to go ahead. I've got a brief statement and I'll take some questions. I may not be able to give a lot of detailed factual answers because if this winds up in litigation, but I'll do the best I can. So good morning, I'm James Ostrowski. I'm an attorney in Buffalo, New York, and I've been retained by the Lighthouse Baptist Church to protect and defend their constitutional right to the free exercise of religion guaranteed by the First Amendment. I am currently suing the governor to end the illegal lockdown established by executive decree and in violation of the state and federal constitutions. That case is pending before Judge Siragusa in federal court in Rochester. And the citation for that is Lewis v. Cuomo. That's 6:20 CV 6316. And the judge's initials are part of the case name, and that's CJS. I am not only the attorney for the plaintiffs in that case, but I'm a plaintiff myself with respect to the ban on church services that was in effect in May when we filed, and also with respect to the mask requirement, which is still in effect. My legal opinion is that the governor's lockdown is blatantly illegal, as ruled by decree is forbidden in American law. His orders violated numerous constitutional rights, and his lockdown has been extremely destructive to the economy and to society, particularly to young people. And we believe the lockdown has also been ineffective. The governor's incompetence with respect to managing our health is shown most clearly by his order placing thousands of infected patients in nursing homes, which was responsible for thousands of unnecessary deaths. There are over 7 million cases of infection in the United States, and no one has figured out how to stop the virus from spreading. Indeed, the situation is worse in the stricter lockdown states. A cell phone study by Donald Luskin, who runs a Wall Street data firm, shows that the lockdown was not effective in stopping the spread of the virus. Currently, Chemung County has had 339 cases of infection and 5 deaths attributed to the virus. New York State has one of the highest rates of death from the virus in the entire world, and its death rate is above what one would expect from the density of population in the state. We should be skeptical of policies emanating from the governor's office. Gilbert Burdine, MD, describes New York's policy as, quote, locking the barn door shut after the horse has already left. And I quote, New York has been a catastrophe. On March 20th, 2020, a full lockdown was implemented. Non-essential businesses were ordered to close. Workers in non-essential businesses were ordered to work only from home. Pharmacies, grocery stores, liquor stores, and wine stores were deemed to be essential and allowed to remain open. Restaurants and bars could only deliver to homes. In addition to the lockdown, nursing homes were ordered shut on March 25th. I misspoke. Nursing homes were ordered on March 25th to accept patients positive for the COVID-19 virus and transfer from hospitals. On May 10th, this order was changed such that patients had to test negative for the virus before being transferred, but the damage had already been done. By April 7th, within 3 weeks of the nursing home order, a daily mortality of over 50 deaths per day per million had been reached. This daily mortality rate was almost 5 times the peak rate observed in Sweden, where no lockdown was implemented. And the citation there is why Americans should accept the Sweden model on COVID-19, Mises.org, MISES.org, August 12th, 2020. I am affiliated with the Mises Institute, just for full disclosure. It goes without saying that we consider any orders directed at the church by the governor or by the county of Chemung acting under the governor's authority to be unlawful, null, and void. State officials who violate the constitutional rights of citizens can be sued for money damages and injunctive and declaratory relief. And they can also, in proper cases, be criminally prosecuted pursuant to 18 U.S.C. 241 and 242. In fact, the U.S. Attorney General has warned state officials that the continued restrictions on religious liberty could result in legal action against them by the Justice Department. After a federal court decision that found that Governor Cuomo had presumptively violated for purposes of an injunction, the First Amendment rights of Catholic priests in Northern New York, the Justice Department stated, "Today's federal court decision is a win for religious freedom and the civil liberties of New Yorkers. Government cannot discriminate by protecting free speech and the right to assemble while threatening or limiting religious exercise. Must protect all rights guaranteed under the First Amendment. The court's decision is consistent with positions and arguments made by the United States Department of Justice in similar filings and letters, including in New York City and elsewhere around the country. The Department of Justice will continue to support people of faith who seek equal treatment against threats and actions by public officials who discriminate against them because of their religion. The Constitution and our oath to defend and protect it require nothing less." In that case is Soos, SOOS v. Cuomo. That's 20-CV. That's 20-CV 651 Northern District of New York. Now let's talk about the Lighthouse Baptist Church. Is everybody still on?
Yes, I'm still here.
I'm sorry, I had a little glitch because I apparently kept the meeting on all night, so I'm getting a little notice from Zoom, but we're still okay?
Yep, we're all good.
Okay.
Yep.
So let's talk about the church. The Lighthouse Baptist Church found out on September 6th that 2 of its members had tested positive for the coronavirus. It responded by suspending its church services. 2 days later, the county issued an order closing the church. The order was issued without prior notice, without a hearing, without specifying how the church could reopen, and without specifying an end date to the order. Contrary to some media reports, the church had taken precautions against the spread of the virus for many months and did cooperate with the county after the current issue arose by supplying a list of recent church attendees and also by encouraging its members to be tested and to quarantine if appropriate. There is a media report of a death connected with the church. However, the church has received no definitive proof that this tragic death was related to any church activity. I urge the county and the media to be accurate in making statements about the church in this regard. There is a false media report disparaging the church for opposing proper medical treatment for disease. This is totally false, and in fact, the congregation includes persons who work in the healthcare field. The church is committed to cooperating with the county to reopen the church in a manner consistent with the health of the community. However, the church and its members have a First Amendment right to free exercise of their religion, and the county itself must comply with the law in this regard or risk federal court litigation. The church contacted the county on September 21st, indicating they wish to reopen this week and committing to a long list of safety measures. This letter was ignored. I called the county attorney on Thursday to discuss reopening. He responded with a letter insisting on a long list of conditions we believe are unreasonable and which are not mandated even by the unlawful executive orders issued by the governor. This morning, I rejected this proposal as unlawful and violative of my client's First Amendment rights. We are not closing the door to further negotiation, but we are seriously considering emergency legal action to reopen the church. That decision will be made this week and will be announced publicly. One other quick thought. We're in phase 4 of this regime, and the proposal of the county attorney and the regulations all pertain to phase 4. But if you ask yourself, what's the next phase, or how do we get out of phase 4? There's crickets, and unless I'm missing something, if somebody wants to send me that, I may owe you a small legal fee, because I've looked and I haven't found it. So one of the problems we have with this proposal and phase 4, which we believe exceeds phase 4 regulations, but the phase 4 regulations themselves, as far as agreeing to comply with them, for how long? This was supposed to be a very short lockdown. The whole country pretty much was on board with that. It was to flatten the curve. But here we are, many months later. The rate has declined steeply in New York, and yet there's no indication of when any of this is ever going to end. So we can't agree on some sort of open-ended extremely burdensome regulatory process that the church has to agree to in order to get back its First Amendment rights. There's no virus exception to the First Amendment. The Constitution the Revolutionary War was fought, and the Articles of Confederation were drafted and enacted, and the Constitution was drafted and ratified and enacted during a time when there were viruses all over the place. There were plagues, there was smallpox, healthcare was primitive. People had very short life expectancies. There was never any understanding that the Constitution was dependent on everybody being in good health, and that if there was some sort of a virus out there, everything in the Constitution would be wiped out, and we'd have rule by decree. But I promise just a short statement. So if there's any questions, and I may be limited in what I can answer, but I'll try to answer anything I can answer. So if you want to just, well, let's see. Why don't I call on Natalie? Because
yeah,
you're first on the board. So
thanks, Mr. Ostrowski.
Sure.
I have two questions. The first question is, how does the church respond to the dozens of cases that are related to the Lighthouse Baptist Church already, and the hundreds that are connected by people who are connected by people in the church that are now under quarantine?
Well, there's 7 million cases.
I'm just talking
in the United
about,
States. So
I'm just talking about Chemung County and the Lighthouse Baptist Church and the surrounding 6 counties. That's what I'm talking about. What is the response?
well, show me the data. This is part of the problem. Claims are being made. We don't have any of the data. We don't have medical records. We're not denying that some people in the church have tested positive. I already admitted that in the statement, and that the church took reasonable measures and cooperated with the county, and asked everybody to get tested. People have been quarantining. The church has been closed for several weeks. We don't know who's gotten the virus from the church or not from the church. We don't have that data. The allegation in the press that there's a death involved, we don't have the death certificate. Can you show me the death certificate? No, because it's confidential. Oh, so the church is just going to stand there and be accused of, possibly having a connection to a tragic death of a person. No, that's not how it works. Show me the evidence. Show me the medical records. We know that. Look, let's talk Turkey here. We know this whole thing has been politicized. There's evidence of inflation of death reports. The thing's a political football, and I guess there's an election going on somewhere that I hear about occasionally. The thing's a political football. I'm not going to get into that. The church is not partisan, but my point is that the church has been unfairly accused of things. There's no evidence at all that anything improper was done. This thing is spreading, has spread, as I said in my remarks, in spite of strict lockdowns. I think the governor himself said a few weeks ago that, well, we're finding a lot of people who are just staying at home are getting the virus. So there's no clear proof of where this stuff comes from. And I think that unless you give the church the data that you're talking about, and nobody's going to give the church or me that data, it's somewhat unfair to ask us to respond. We've admitted that there's been some cases of people in the church. We don't know. You can get this thing anywhere. You can get this thing out at a restaurant. You can get this thing at a protest, as the court stated in the case that I spoke about. Religious services, including my own Catholic church, they were shut down completely. And then a few weeks later, there's like hundreds of thousands of people hitting the streets. But because that's, they're on a political side with the people who run the state, that's completely ignored. Well, I think it was Judge Sharp, I might be misstating the name, but the Seuss case, that did not sit well with the judge. You can't do that. So there's lots of people doing lots of things out there in society. Even with safeguards, things are still spreading. Obviously, medical personnel have gotten it. And there may be some factors there with the load of the virus and stuff I'm not competent to speak to, but there's really no way we can respond to allegations of that nature unless we have the data. We're never going to get the data. So what do you want me to say? The church has been victimized by this pandemic, just like we've all been victimized by the pandemic. I think everybody's trying to do the best they can, with possible exception of that nursing home issue that I mentioned in my remarks. So any other questions?
I just had another question.
Sure.
Can you, you touched on it briefly, but can you expound on how religious freedom supersedes public health in this instance with the Lighthouse Baptist Church?
Well, prove to me that it's inconsistent with public health. There's no scientific evidence that the lockdowns have worked. If you look at Sweden today, the virus has basically disappeared, and they didn't lock down. If you look at a few months ago, Kentucky, which I think has a Democratic governor, again, you can't separate politics from this. They were saying, well, all these people are coming up from Tennessee and getting us infected because they have a looser lockdown than we do. Well, as I said in my legal brief the other day, Tennessee is doing better than Kentucky. So,
sir, I don't mean to interrupt, but I'm talking
yeah.
specifically about the Lighthouse Baptist Church in Horseheads, New York, and
Right.
how this case and how the church, through your legal counsel and advisement, is talking about religious freedom supersedes public health in
No,
Chemung and its surrounding counties.
You're saying that. You're begging the question. You're assuming without any scientific evidence whatsoever. And if you have any, let me know, because I have to submit further papers to Judge Siragusa on Wednesday, that the best way to deal with this pandemic is the lockdown, the Cuomo style lockdown. There's no evidence for that. New York is second in deaths per million in the United States, second only to New Jersey. New Jersey is the most densely populated state. New York is the 7th most densely populated state. Why does New York have a death rate that's higher than its rate of density? Why are there countries such as South Korea that didn't have a full lockdown? Why have they done better than us? So you have to. Nobody is in favor of religious services without precautions being taken, and they have been taken.
I do have one follow-up.
Yep.
The last week, Chemung County Executive Chris Moss held a press conference in which he addressed the fact that they have firsthand knowledge of the churchgoers not following the mandates of social distancing and the gathering numbers and mask wearing. What is the response from the church?
Well, yesterday, the Erie County Executive, Mark Poloncarz, who's the big lockdown advocate here, was seen taking a photograph, a close-in photograph with about 17 people without a mask on, and none of them had masks. So if you're saying we saw Nancy Pelosi get her hair done, look, nobody is strictly complying with this. So what about the Antifa riots and looting? What about the Black Lives Matter? What about the massive protests in the street? Come on, nobody. I think all people of good faith, including the church, are trying to do a good job, but literally nobody is strictly complying with these things. So it's unfair. They've done the best they can. They're human beings. When you have laws that sort of are just impossible for normal human beings to follow, there's going to be some divergences from what we would all prefer. But again, county executive in Erie County, he had to apologize yesterday. Nancy Pelosi, of course, never apologized. She started accusing other people of. So if you could show me evidence that that there's strict compliance with these things throughout the country, then, maybe we'll do a mea culpa for the church, but not at this point.
Thank you, sir.
George, Mr. Stuckberger, go ahead. I'm just
Um,
going in order of my screen, so.
Okay, I have a couple questions. What specific guidelines was the Lighthouse Baptist Church following regarding COVID-19?
I don't have all the details in front of me. They were doing the standard things. They were encouraging mask wearing, social distancing, hand washing, and things of that nature. The things that I think pretty much everybody in America is doing, and they're willing to, as I said, we're willing to negotiate a set of formal rules. It's just that the rules can't exceed Phase 4 regulations.
Were
And
they encouraging
there has to be a
the
timeline.
guidelines, or were they?
They're not going to
requiring
agree to do
guidelines?
this forever. Let's face it. We'll go to court first.
Okay. The state guidelines say no more than 33% capacity, 6 feet, face coverings. Was the church following all of those guidelines issued by the state?
I just got into this case. My understanding is they've made a good faith effort to take reasonable safety precautions. I believe the 33 1/3 limit is clearly unconstitutional because people are thronging into non-religious businesses and meetings without that restriction. I think that's probably something that a court would strike down.
Okay. Do you know the building capacity?
I don't exactly. I think it might be in the range of 250, but I'd have to get back to you on that.
Okay. So the First Amendment obviously protects, freedom of religion and practicing religion. I know in the Christian community, it's often said that the church is not the building, it's the people. So if the people could gather outside or on Zoom, like thousands of other churches have, that wouldn't be restricting their First Amendment rights. So why did they have to physically be in a building where the virus could spread?
Yeah, I'm not a theologian, but since ancient times, the Christian religions have emphasized personal contact, and it's hard to sort of offer somebody peace, on Zoom. Certainly, in the religions that have somewhat different ceremonies than perhaps this church does, you can't really Zoom it. Now, it's interesting you say outside, because the church did seek a venue in one of the county parks, and my understanding is that they were refused that permit. So that's actually something I'm going to be looking into, and if there's any litigation, that might be something that comes up in the litigation. But we're reasonable. They have tried to do outside events. We're worried about having an event in their parking lot. We don't know what's going to happen. They seem to be, this is a problem that New York has failed to deal with, in spite of what they say. And when politicians fail, they often look for scapegoats. And what a better scapegoat than a small Baptist church, let's face it. So there's an atmosphere of concern and worry, and that's why if we can't work this out in the next few days in a reasonable negotiation, we're probably off to federal court.
Okay. Did the church attempt or offer any Zoom or internet services, or are they strictly only looking for an in-person physical service?
I think they have done that, but at this point, it's been several months. The infection rate is declining in New York, so they're ready to resume, personal services with reasonable precautions.
Okay.
Yeah, go ahead.
And you mentioned back in, when the Constitution was first created, how smallpox and all these other things were going around. At that time, that's 200 years ago. We didn't have the, you said look for specific evidence, but they didn't have the technology that we do now, so they didn't understand that. Why is it what's the difference really between 200 years ago and right now, where they didn't understand what smallpox was, but we have scientists saying this is a virus, it spreads through the air, it spreads through contact, and people sitting close together in a pew, passing communion, sharing Bibles, shaking hands. That sounds like an area where a virus would spread.
Yeah, and everybody understands that, and everybody has taken precautions. But these scientists, we talk about the science, but you're talking about not just medical science. You're talking about locking down the economy. You're talking about shutting people into their homes. We know there's been an increase in suicides, threats. We know that people are consuming more alcohol. Young people are depressed. They're being, hear me out, they're being deprived of their youth. The economy has crashed. And if you know anything about economics, there's actually a strict correlation between the unemployment rate and life expectancy. Poverty kills people. So it's not just up to the so-called medical scientists. This is social science. You have to take into account economics, psychology, and history. And there is no clear scientific case, again, in favor of a lockdown that, among other things, has deprived people with illnesses other than COVID from medical treatment. And we're probably going to find that there's deaths and increased illness in that. So this isn't simple. This is actually really complicated. And as I laid out in my statement, if you're looking for people whose past performance gives you confidence as to what they're recommending now, you don't really want to go to New York State, because they really messed this thing up, and all the numbers show that.
You said the Chemung County attorney gave you a list of conditions, but you said were unreasonable. Can you disclose what those conditions were?
Well, the ones that I have a problem with is there's two separate, like, daily logs that he wants submitted. And I looked at the phase 4 regulations. By the way, this is all very fuzzy, even for a lawyer. I'm not used to dealing with rule by decree. I'm used to dealing with legislation. And the governor's got, like, Empire State Development, which, by the way, I sued years ago because they're illegal corporate welfare. But what is Empire State Development doing with issuing these types of guidelines? The governor's parceled things out to these regional commissions. So you got, like, rule by decree, which is illegal because the legislature can't delegate their legislative powers. And then the governor's, like, delegated to other people who issue these guidelines. It's tremendously difficult and frustrating, but I don't see where the guidelines require daily logs. Is like Wegmans supermarket sending daily logs?
I would say
to the governor, like, I hope not, because I don't want to pay that much for my food. I mean, how would they even hire the staff to do that? So, and the other big objection I have, again, which is that there's no termination date to this. This is apparently going to go on forever. And if I'm wrong about that, tell me where the governor stated when any of this madness, frankly, is going to end. So those are our main objections.
Okay, so the daily logs, do you view the daily logs as an impediment on your First Amendment rights to practice the services, even if they help in the contact tracing?
These are not. It's the submission of a daily log. It's
So how does that impede First Amendment right to?
It's not just that they're supposed to keep a log. It's that there's two separate logs in there they have to submit daily. It's too much. It's not justified. They don't have the legal authority to do it. And even if they had the legal authority to do it, there's no scientific evidence that this type of burden is justified. everything's a balance. You could, if we locked everybody in the house for the next month and order them not to go to any buildings over 2 stories high, we could eliminate all elevator accidents forever. I mean, everything's a balance.
But how many people have died in an elevator accident versus the number of people
I'm just
who have
using
died?
that as an example. We've got people rioting in the streets. Do you know why George Floyd, do you know that George Floyd was laid off in the lockdown? Did you know that? I mean, when you shut down society, you're doing something that we've never done in like 12,000 years of organized human living. It's an experiment. It's a great leap into the unknown. And does anybody really like what they've seen in American society in the last 3 or 4 months when everybody was supposedly locked down? Daily riots and looting in many American cities. If you don't think there's a connection between all this, I'm going to disagree with you on that. Everything is connected to everything else. And the bottom line is, as we said in our complaint on March 15th, before the George Floyd riots, you guys aren't smart enough to run society like a dictator. They're not smart enough. They can't figure it all out. And it has not worked, and it needs to end. And we're not going to accept unreasonable. We're willing to compromise and go along with things that we think are illegal just to avoid litigation and to get the church back up and running. But we're not going to go along with these conditions that have been stated.
Okay. This is probably my last question.
Sure.
Should the freedom of religious expression and the freedom to have services supersede public health?
No, I don't think they're inconsistent. Frankly, I think religious belief, I'll bet you I could find that religious belief is correlated to public health in a positive manner. So again, it's a balance. It's a big picture. You can't pick it apart like that. But again, that's again, forgive my philosophy major talk, but it's called begging the question. You're assuming that the governor's lockdown regime is good for public health. Show me the evidence. It's not there. Lisa, sorry. Is Lisa on? And Jackie Gleason?
Yeah, no questions from Jackie. Thank you.
Okay. And then, I'm sorry, the middle initial M.
Matt Kleindienst.
Yeah, you want to go?
Yeah, I just have one question. So in talking to the Chemung County DOH director, he told me that initially when the first cases were reported by the church, that there was initial cooperation within the Lighthouse Baptist Church. Then by the end of the week, things had dissipated to the point where there was hardly any contact between the county DOH and the church by the end of the week. What changed between the beginning of the week when the cases first were being reported and the end of the week when there was practically no contact or communication with the county DOH?
Well, I wasn't involved, but I think they talked to some attorneys. And I think the attorneys may have told them, you've got to respect the rights of your parishioners, rights to privacy, rights to medical privacy, rights to religious freedom. Who wants to just start handing, in today's litigious society, who wants to just start handing out information to people? You might end up getting sued. You might end up damaging lives. I mean, just as a hypothetical, I mean, if somebody, let's say somebody went to the ABC church because they were suicidal, and the next thing you know, they end up on some sort of a list, and they're going to get contact traced. I mean, there's a lot of serious ramifications. So the church was just acting responsibly. When they got a subpoena, which creates a different legal situation, they did supply names. So they were just acting responsibly. That's all. In the Channel 18.
It's me again. We have a separate recording.
I'm sorry.
I just want to follow up real quick. And sorry, I forgot. Come back. Actually,
Yeah.
it looks like there are members of the church who are on this call. Would any of them like to make a statement or add anything to this?
They're not going to make a statement because if we end up in litigation, that statement, could be used, and we don't want to sort of accidentally do litigation here. Anybody else have any questions?
Sir, this is Natalie again. I just I wanted to understand how was it that the church came to find your legal services? Did they reach out to you? Did you reach out to them?
Well, I don't reach out to people because I may be old, but we were told not to do that. I know maybe things have changed. I think they got my name from, I don't really know how they got the referral, but if you do some Googling, you'll see that I'm involved in lockdown litigation, and I do First Amendment litigation, I do Second Amendment litigation, Fourth Amendment. So I get lots of calls from
And when
potential litigants throughout the state, and I generally try to stick to Buffalo, but Elmira is not too far away.
when was it that you became involved with the case?
Just last week.
And I have a follow-up as well.
Yeah, sure. Go ahead.
So we talked about the church as a building idea, or and how other churches have done Zoom. If thousands of churches around the world, probably more than that, have turned to Zoom or other features, why couldn't this church?
Well, they could, but the First Amendment gives them a different option. I mean, my church
So why are they special compared to these other churches?
My church is doing Zoom. That's not why I go to church. I go to church to I want to see my fellow parishioners. I want to eyeball the priest.
I can see you on Zoom.
To compare Zoom with an actual in-church experience, I don't think is accurate. But in any event, in this country, see, we don't live in a totalitarian dictatorship, okay? Governor Cuomo does not have the moral, legal right or the practical knowledge or experience to be a dictator. Those rights were already decided by constitutional conventions that created a framework for the government before the government even existed, really. So that's the deal we struck. If you want to go back and say, if there's a health crisis, the government now has totalitarian power, well, maybe the people wouldn't vote for that. Or maybe people would move out of the state, move to a freer state. As many people, of course, as we all know, are fleeing New York State because it is the least free state. If you look at the study by Jason Soren's Freedom in the 50 States. But the bottom line is that's a choice that the Constitution gives to the church and not to a politician or a bureaucrat or a cop.
This is Natalie again. Can
Yep.
you just answer what exactly the Lighthouse Baptist Church wants in the end from all of this?
They want to go back to normal, but understanding that as long as there is a virus out there that does negatively impact on a certain percentage of the population, that they're willing to take reasonable precautions. That's what they want. Any other questions?
What are those reasonable precautions that they are preparing to take or have already taken?
Well, it's a laundry list of things that we've all been doing. As I said, social distancing, mask wearing if you're not in the household, cleaning, minimizing hand contact, cleaning up facilities frequently, those kinds of standard things. Nothing unusual. As I said, would really, I think the deal killer here is when they added things that aren't in the regs. and don't have a termination date. Because that's really concerning that this thing's going to go on forever. When Sweden's opened up and they have very few deaths and a relatively low rate of infection, and in spite of the mainstream media propaganda, their death rate is much lower than New York's. Any other questions? Otherwise, we'll wrap it up. And thanks everybody for participating. I hope we had a couple of technical glitches, but I hope it worked out pretty well for everybody. So I'm going to sign off then, and we'll let everybody know what our next steps are through a press release.
Thank you.
Okay.
Thank you.
Thank you, sir.